The Gauteng Health MEC, Dr. Gwen Ramokgopa, to tell us about how it all works. MEC, good morning, and thanks for your time this morning before you head to the launch as well. So explain to us how this works, because in our minds, ATM is something completely different. Yes. How is this going to work for now in Alexandra for patients to get their medication?
What patients would need to have, obviously, is a script, barcoded ID, and they would also have a PIN code. They'll be able to it's a touch screen, a facility. They'll be able to talk to a pharmacist on a remote basis.
Oh, so there's a live person on the other side.
Yes.
Okay.
But for now, we also have on-site, just in case, just for the comfort. And thereafter, you enter in your script, coded, it's barcoded as well, and the robotics goes and fetches your medication, and lo and behold, it's dispensed. And within 3 minutes, you also have a receipt. I think this is really revolutionizing the health system. It is digitalizing and modernizing the health system to improve quality of our health services. We know that one of the biggest problems, it's long waiting times, it's queues, and so this facility, the ATM Pharmaceutical Dispensing Unit, will certainly go a long way.
Okay, I want to talk about the possible complications in just a moment, but for now, this is being launched. We had a pilot project that happened at Tembeletu Clinic in Johannesburg. That happened, what, about 2 years ago, I think? How's that been going? What have been, if you know, maybe some of the glitches? Has it worked? Has it gone without any complications? Has it?
Relatively gone without any complications, but we had anxieties initially when we had to use the ATM for our money. You remember, you used to go into the bank. Those anxieties are there. Secondly, the Pharmacy Council requires that on site there must also be pharmacists or pharmacy assistants, so those are available. And finally, it's also that the patients need to appreciate that if you don't have a barcoded ID, you cannot have access. So most people really now uses the ATM, so it's an easy technology to interface with.
So the obvious questions would be something like safety, the safety of this. I mean, is this something that will run 24 hours?
The dispensing unit runs 24 hours. It is in areas where there are malls, and there's usually common security there, and it is remotely managed as well. There is a support which is centrally based around Centurion area, in addition to the on-site pharmacists that are there.
So the obvious concerns, MEC, like I was saying, safety when you are actually trying to get your medication. What about getting it wrong? What about the robotics? I mean, we know it's possible. We know it can happen. What about getting the wrong medication?
That is why the Pharmacy Council requirement that there must be a pharmacist on site is complied with, and the backup is also a pharmacist in a remote site. So those are the safeguards for patient safety. We have a similar machine in Steve Biko Academic Hospital, but that one is within the pharmacy itself. So the Robotics goes, collects the medication, gives them to a pharmacist, and the pharmacist dispenses. In this case, the pharmacist monitors that indeed what the robotics picks up, it is the correct medication, the correct strengths for the specific patient.
So all of that is checked by a person?
Yes, it is not the first time in the world, but certainly is the first time that we use this facility in South Africa. And this is part of modernizing. You know that we have also a chronic medicine dispensing unit with many pharmacists all over, private pharmacists. So this is an addition to the world to come. It's part of Industry 4. And the health sector should not remain behind. So
practically, how does it work? I go to a doctor. That doctor has to send that script to that particular pharmacy, or gives me a script like they normally do. I feed that script in like I would my bank card.
Yes.
How does this work from scratch, from that visit to the doctor?
You get a script, and on site you give the script to the pharmacists that are there.
Feed it into this machine.
And they barcode it, and you go to the machine, you enter the barcode, you enter your ID, you actually just scan your ID. It is touch screen, and because it is also cloud-based, if there are any glitches or you have entered the wrong number, someone will actually talk to you. It is like
it's like entering the wrong
Skype.
PIN.
Yeah,
okay.
It's like Skype. There's someone also says you've entered the wrong PIN. Try again. And lo and behold, once it's done, the robotics goes, fetches your medication, comes, dispenses, and you have a receipt.
All right, so this is going to be launched properly now in Alexandra today. Will this only be, is it only for patients with chronic illnesses, and will it only be for people who live in Alexandra at this stage, or anyone from Joburg can go and try this out in Alex?
We obviously, we have had to pilot it before the launch, and this was mainly to support the clinics around Alexandra. And it was a controlled environment. We've got 4 such dispensing units on site with proven concept. And the next would be Soweto and Diepsloot. And within no time, yes, we will tell you, but not today.
Okay.
And in no, because we interact with the stakeholders there, and in no time, that will be the way of doing business. Like we dispense or we take our money from ATMs, it will be a way of life.
Now, MEC, I would imagine that majority, I'm not saying all, but majority of those patients with chronic illnesses are the elderly, are the older ones. Is there any sort of education for them when they get to this ATM? Many who probably don't know how to use an ATM also. Yes. Is there somebody to guide them in the first couple of weeks or months, their first try at this new system?
Most definitely. One is that you need, it's really for chronic patients for now, because you know that when you are ill, you need to go to a doctor or a nurse clinician who would then examine you, do tests, and then prescribe. And if you have medications and you are stable, you have a prescription for 6 months, or if you get sick. So if you're not ill, then you can go and dispense. The dispensing is for a maximum of 2 months. So far, 4,000 patients have used this facility with 8,000 dispensers and 18,000 medications given out. So indeed, it is a concept that works, and I have no doubt that it will be a way of life in no time.
Should pharmacists worry that they'd be out of a job?
Not at all, not at all, because pharmacists need to be there for quality assurance.
Okay, thanks very much. Good luck with the launch. I can't wait to see how this actually works. Thank you very much.
We also have bankers, so we'll always have pharmacists.
Okay, thank you very much. And that's Health MEC Dr. Gwen Ramokgopa. She's heading off now to launch this new medication or ATM pharmacy that's had that launch happening in Alexandra a little later on this morning. Well, health